So you have these patients pay a monthly subscription.
Right.
And how accessible are you? Are you available during the day? Are you available on weekends?
Yeah, so we have a membership that provides everything within the four walls of our clinic. So if you come in for a physical, that's covered. If you come in because you hurt yourself, that's covered. Do I need to sew you up? That's covered. Do I need to do some cryotherapy to take off a actinic keratosis? That's covered. Do I need to do a little surgery to take out a lipoma or whatever? All that is covered in our membership fee. There's nothing extra. We also do EKGs. We also do pulmonary function tests. Those are all included in the membership.
And EKG is included in the membership.
Right.
So just out of curiosity, to give them an idea of how much these things cost, what would, I imagine you know this, because when we, in the free market medicine space, we know the prices outside and inside insurance-based and non-insurance-based. So what would an EKG outside of your office usually cost at the hospital?
You're right. I do lose track of some of that stuff, though. So it may be a couple $100.
Yes.
And then you have to also pay for the cardiologist to read it.
Which is another couple hundred at least, right?
Exactly.
Right. So you're talking a $500 bill.
Right. And we have this network also for things that I don't do, for example, like ultrasound. We have an ultrasonographer that comes in. Her fee is typically around $225 for checking the abdominal ultrasound or pelvic ultrasound. And it's a little bit more for a cardiac echo, which is fine. It's worth more. But that price also includes the radiology reading. So I read the x-rays in my office, but then I also get an overread for no extra charge. So we charge the patient, the ultrasonographer or the x-rays the same way. It runs about $125 for most x-rays, 2-view chest, 3-view ankle. They charge us and then we charge the patient. Mm-hmm. We don't add anything to that. We just do that so that they're not begging money from our patients.
Yeah.
So we cover the risk there, although there's virtually no risk. So we have that network for those type of things. We have also a network that just provides MRIs, CT scans, some specialty care.
So MRI is a common one. When we talk about, the average person can't afford to pay cash for an MRI. Give an example of that. MRI in the hospital versus MRI you pay in cash.
Yeah, again, MRI probably in the hospital is going to be over $3,000. And that, again, is going to be a added on charge for the radiologist to read that. Most of our MRIs are all under $500. And again, that includes the read. Now, you may have to travel 30 minutes to get that. But
to save $2,500,
everybody wants to do that. Everybody wants to do that.
And tell me about, so a lot of times with an MRI or some of these procedures, when you're going through insurance, it takes months to get prior authorized, correct?
Right.
So for a cash MRI, how soon can somebody be seen?
Within a week.
Yeah.
Yeah.